So here we have a typical patient, somebody who has had a problem with the lower abdomen since childbirth, since her 20s, and despite a good diet and exercise regimen, it's an area that persists and that won't go away. So this will be able to treat with probably the Coolcore applicator on the Coolsculpting in order to reduce this. All right, so this is very typical. You have a small collection of fat that won't go away in the lower abdomen, and this is something that we can treat with one of the pieces that comes in. The Coolsculpting treatment pieces come in 4 different shapes, which are designed to fit the contour that you're trying to treat. The Coolcore Plus is good for tightly curved areas such as the flanks. The Cool Fit is good for flatter contour such as the upper abdomen or sometimes the lower back. The Coolcore is good for lower abdomen for regular size or a smaller roll, and the Cool Max is the largest piece, which is good for debulking, and this is used for larger lower abdominal contours typically. This is a bit too small to treat with the Cool Max because you don't have enough width or enough bulk. However, something like the Coolcore would fit very well down here, and this is something that you can treat the lower abdomen. For future planning, you can also possibly look at the upper abdomen being treated in different patterns to catch the whole thing. So we're going to mark it based on a single lower abdominal treatment. And based on where most of the bulge is, that's where we're going to center the piece. So that marks the center of the bulge. And this is going to let us see the extent of the piece on her skin, so that these marks can guide exactly where the treatment piece goes. At this point, we've marked the area of interest where we're going to treat. We will get Laura comfortable on the Coolsculpting treatment table and protect her clothing from any dripping from the gel pad. The gel pad is designed to maintain an even temperature and protect the skin from any frostbite. It also allows lubrication of the skin so that the skin roll and fat roll can actually go into the vacuum piece as effectively as possible. This is a gel pad, and this is going to feel cold going on your skin. And at this point, the vacuum gets turned on and the applicator put into place. And that is perfect. So this here you can see where the roll of skin and fat has come up all the way up to this portion of the plate. So that entire area is going to get cooled and treated. So you can expect to see fat reduction and everything that was put into there. And at this point, you can start the cooling. Next step is to get you comfortable so that this is well supported and you have everything that you need within reach. So how does it feel? Is it comfortable?
Yeah.
So at this point, we want to make sure that she's comfortable, and you get a call button so that if you need anything over the next hour during the treatment, we can get that for you. This will prevent the piece from becoming dislodged and aborting the treatment. And once the timer hits towards 0, the machine will alert the staff that the treatment is nearly done. And at this point, the massage portion of the treatment can be performed. This will be for a couple of minutes in order to reestablish blood flow, and this will complete the process to program the fat cells to knock themselves out over the next 3 months.